We kindly ask that all, thank you, Kyle. We kindly ask that all audience members remain on mute. And when we get to our speakers, we invite you to put your questions in the chat for our Q&A at the end. More on that in a minute. We're really proud to host this special event, and shortly we will hear from our wonderful speakers. However, I'd like to formally begin today with an acknowledgement of country. So we wish to acknowledge the traditional custodians of the lands we are meeting on. We wish to acknowledge and respect their continuing culture and contribution they make to the life of these cities and regions. We pay our respects to elders past, present and emerging, and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and waters of Australia. So if you've just joined us, welcome again. And thank you for joining Recovery Partners, the Pelvic Pain Foundation and Endometriosis Australia this morning. My name is Liz Tierney and I am the Marketing Coordinator at Recovery Partners, and it's my absolute pleasure to be hosting this event. So as mentioned before, the session is being recorded. We ask that you stay on mute. If you have logged in and your name appears as guest and you wish to change this, you can change it by clicking on the 3 little dots beside your name and opting to rename yourself. And when we do get to the question section at the end, as a disclaimer, this is a broad presentation about endometriosis in the workplace, so we can't provide any individual medical advice. So any individualised treatment questions need to be directed to your health professional. Right. So the reason we are able to bring you this event today is because Recovery Partners won the SafeWork South Australia 2022 Augusta Zadow Award for our proposal, More Than Women's Issues in the Workplace. Our team in South Australia identified that endometriosis is a significant burden to not only those who suffer, but to the Australian economy. So this webinar is all about creating awareness and understanding of endometriosis. We will provide education on the impact of endometriosis on the individual, the workplace, and the wider community. We'll also offer practical solutions on current evidence-based research for both women or those assigned female at birth in their day-to-day lives, and for organisations with the goal to improve the management of endometriosis in the workplace. So, on to our speakers. Today we'll be hearing from 4 impressive speakers who bring a wealth of experience, knowledge and passion to help us all navigate endometriosis in the workplace. So a very warm welcome to Associate Professor Susan Evans, Alexis Wolfe, Hayley Davies and Eva Jacob for joining us today. And I'd like to sincerely thank them in advance for their time and contribution to this event, because without question, it's only made possible with their generosity and knowledge. So thank you. So we'll hear from them shortly and then finish with the question and answers segment, which I mentioned just before. So please hold any questions until the end, and then you can submit these in the chat. So our first speaker today is Eva Jacob. So Eva is an accredited exercise physiologist with a master's in women's health medicine. Eva has a passion for providing up-to-date evidence-based research and promoting the importance of women's health within the workplace. Eva has over 6 years of experience working as an exercise physiologist and women's health practitioner, and is experienced in working closely with women who suffer from endometriosis and their inability to return to work due to their condition. So thank you so much, Eva. I'll hand over to you now to get us started.
Thank you for the introduction there, Liz. I'm going to jump straight into it. So endometriosis affects 1 in 9 women, transgender, non-binary and gender diverse people assigned female at birth by the age of 44. It is the most common benign gynecological condition to affect women of reproductive age. Endometriosis is defined as the presence of tissue growth, or similar to the endometrial tissue, at sites outside of the uterine cavity. So this is where the tissue grows outside of the normal cavity, causing pain and inflammation. It is usually found within reproductive organs, but has been found to adhere to the bowel, bladder, muscles, joints, lungs, and even the brain. And we know that endometriosis is a chronic inflammatory, estrogen-dependent disease. Despite the prevalence of endo in Australia, we are starting to hear more in the news and social media about the debilitating effects of the condition. Unfortunately, diagnosis is still typically delayed by years. Misdiagnosis is common, and symptoms are often overlooked as period pain, causing delivery and effective therapy to be prolonged. Endometriosis has an estimated diagnostic delay of between 6.5 and 8 years. So quite a long time before someone can get a diagnosis of endometriosis. Endometriosis has historically been under-recognised, under-treated, and due to the variability of symptoms, there is a reliance on surgery for a diagnosis. And we see the stigma and cultural taboos which create barriers to talking about endometriosis. It can be painful, inflammatory, can affect fertility, and reduced participation in school, work, social and sporting activities, relationships, and overall quality of life. Thank you, Kyle. So moving on now, we're looking at the cost and burden of endometriosis. So as I mentioned, symptoms of endometriosis affect quality of life, hobbies, exercise, relationships, work, and schooling. And I want to bring your attention today to the effect of endometriosis, specifically on the workplace, and the annual economic cost of endometriosis to the Australian economy. The annual economic cost of endometriosis is $9.7 billion per year. That's an estimated $20 million per day. The majority of costs were due to productivity loss, and this was largely measured as missed work hours and productivity at work. So these costs include costs to employers from absenteeism, presenteeism, and also including loss of wages for individuals who cannot afford to use any more sick leave or personal leave. Ernst & Young completed a report on the cost of endometriosis for EndoActive and the burden to the Australian economy in 2018. And from this report, it was found that average days taken off per month for endometriosis and chronic pelvic pain from respondents were 3 days a month, with more than half of respondents needing to reduce their work hours. The report found that 60% of sick leave is taken on average by women suffering from endo because of the chronic pain they experience. Thank you, Kyle. And I want to bring your attention now to the burden and concerns in the workplace of endometriosis sufferers. So nearly all women with endo have identified their symptom management had a significant impact on their work life. Many are fearful of raising the issue in the workplace. They're concerned about what their employee or work colleagues might say. And 50% said the lack of flexibility in the workplace is a significant problem. As we mentioned before, $2.6 billion is attributed to the loss of productivity to the Australian economy. And 70% of endometriosis warriors have to take unpaid leave to manage their symptoms. In Australia and internationally, there is a pressing need to improve the response to the condition and improve the quality of life for those affected. Given there has been little attention directed towards endometriosis to date, there is a need for significant improvement in outcomes for individuals with this condition. With earlier diagnosis and intervention, broader multidisciplinary treatment options, and improved management plans or pathways. Now, the National Action Plan for Endometriosis was released in 2018 by the Australian Government from the Department of Health. And the action plan aims to improve the following: increased public awareness of endometriosis, improve the patient understanding of the condition, improve the treatment options available, and further engage in research programs into endometriosis and chronic pelvic pain. Now, the National Action Plan for Endometriosis has identified 3 main goals. The first one being greater awareness and education. And they've put a focus on timely education, increased awareness for patients, health professionals, and the Australian public. That includes stronger appreciation and understanding for endometriosis as a complex chronic condition. and the psychological and social effects of endometriosis, as well as communication regarding its potential effects on women's fertility and the social and economic participation. The second goal is to improve access to services that are appropriate, available, and accessible. So providing those evidence-based clinical guidelines and effective accreditation processes for clinicians to promote diagnostic and treating improvements. Lastly, the support for further research and relevance to endometriosis. So they really want to improve and support clinical trials and research organisations. The National Action Plan for Endometriosis suggests support for further research is required. There is a long way to go to improve outcomes for women and young girls living with endometriosis. Thank you, Kyle. So as Liz mentioned before, Recovery Partners was awarded the Augusta Zadow Award for 2022. Augusta Zadow fought for the work, health and safety rights for women and young workers in the late 1800s. In recognition for her work, SafeWork SA established the Augusta Zadow Awards to support initiatives, research and further education that improves health and safety for young women in South Australia. Recovery Partners recognise that women with endometriosis are struggling to maintain employment, maintain their focus and concentration at work, and deliver quality projects resulting in a decline in productivity within the workplace. So our hope for the 2022 Augusta Zadow project is to further increase awareness on endometriosis within the workplace. On behalf of women and young workers, our project is designed to develop widespread, context-specific workplace awareness. And we're going to do this by educating staff and employees on the burden of endometriosis. We are hoping this will prompt organisations to further enhance the importance of lifestyle factors, the importance of overall health and well-being within the workplace, and to essentially to improve the outcomes for these women. The project will aim to accommodate and support employees to understand how to build a supportive workplace culture, how to start open and honest conversations, and how to assist with arranging flexible environments and job modifications for individuals suffering from endometriosis. So there's lots of exciting things happening here. I'll now pass you back to Liz, who will introduce our next guest speaker. Thank you.
Thank you so much, Eva. That was really, really interesting. And as you've clearly outlined the different burdens and far-reaching burdens, there's certainly a pressing need to improve support in the workplace. So thank you for sharing that. So we'll now hear from Associate Professor Susan Evans. Associate Professor Susan Evans is a gynecologist, pain physician, PhD, author, and lifetime believer in the abilities of women. Fostering equal opportunity for women takes many forms, and Susan's life focus has been in the management of endometriosis and pelvic pain. Associate Professor Evans is chair of the Pelvic Pain Foundation of Australia, co-developer of the Periods Pain and Endometriosis Schools Program, or PEP Talk program, author of the book Endometriosis and Pelvic Pain, and is also developing a new intrauterine device to reduce pelvic pain in women. So quite the CV, Susan. Thank you so much for joining us. I'll pass over to you now.
Thank you so much, Liz, and thank you for inviting me to speak at such an important webinar as this. If you've got endometriosis or you're working with someone with endometriosis, you'll know that it's been under-researched, under-recognised, under-managed for like forever. And there's a role for everybody in making a change to improve life and for all involved. So next slide, thank you. Now, it was very great of Eva to speak about what endometriosis is. So you'll know already that there's tissue like the lining of the uterus around the pelvis where it shouldn't be. But you know, if you've got endometriosis, I don't think you went to your first appointment with a health practitioner saying, I've got spots in my pelvis. I reckon you came because you had pain. That would be the most likely situation. And so I'm going to talk today about how all the symptoms and the real life experience of a person with endometriosis unfolds. So generally, the commonest way that it starts is with period pain. And period pain can be pain from the uterus, or it can be pain from endometriosis lesions, and often it's a combination of both. And this problem starts really quite young. Most of the people with endometriosis will say that the periods began to be painful either with or very soon after their first periods. As I said, everyone's experience is a little bit different, but that's the common one. So let's say we're starting in our picture here with a uterus plus or minus some endometriosis and bad period pain. Next, thanks, Kyle. Now, in this picture, I've actually included a lot of the structures in the body that are involved in the symptoms that may have happened next. Now, if we get down to what that whole experience is, that big picture of endometriosis and pelvic pain, then really it's an inflammatory condition that affects many aspects of the body. And I'm sure you'll appreciate that. It's not just the spots in the pelvis. So here we've got the bowel, the bladder, pelvic muscles, the spinal cord, and the brain. And these organs all talk to each other. And as I say about pelvic organ pain, when one of them's unhappy, they're all unhappy, or they all can get unhappy. So if you start with bad period pain, often it's common to then go on to an irritable bowel, food intolerances, sometimes bladder troubles. You might find that your bowel only behaves well when you give it exactly what it wants. And if it doesn't get exactly what it wants, it will complain. Next, thanks, Kyle. And actually, these things change. And if you might look at all these symptoms in those gold stars there, and you've probably got quite a lot of them. You don't have to have all of them. And that's really why this is what doctors would call a syndrome. Symptoms that cluster together. If you've got one, you're more likely to have another one. You don't have to have all of them. But in it, we can see that mix of the period pain, bowel symptoms, food intolerances, bladder symptoms, maybe going to the toilet more often or having to get up at night or having to rush to the toilet. And those organs are all connected by those black lines into the spinal cord. And so even though the pain might have come from one of those organs, the bladder, the bowel, or the uterus, or the endometriosis lesions, when the brain's thinking about it, it finds it really hard to think which organ did it come from. So a lot of women describe that when they get the pain, it all feels much the same and it's hard to separate. Now, when you've got pain in those pelvic organs, the next thing that often happens is that the impulse and the inflammation and the pain will spread to the pelvic muscles. So they're those ones I've written down there. And then you'll start to get things like an aching pain or a stabbing pain on a side of the pelvis, one side or both that might go through to the back, might go down the leg a bit, might be a stabbing pain up the vagina or up the bowel. And those things, you often want to curl up in a ball, love your heat pack, find it a bit harder to walk around, things like that. That's the secondary pelvic muscle pain. And then over time, you get this thing that doctors call pain sensitization, where the spinal cord and the brain have physically changed. Those neural pathways and the influences that affect that are actually amplifying those impulses. So then you start to find that it's not just period pain, it's pain on more days, and when it's not just your period. And you can find that what used to be not painful becomes painful. What used to be painful becomes worse, and the pain comes on more days. And then, of course, there's those effects on the brain and how we feel, where you might start getting fatigue, poor sleep, low mood, anxiety, nausea, dizzy, sweaty, faint, those sorts of things. Now, luckily, not everybody gets all of these, but they can. Next slide, thanks. So we end up with groups of symptoms. And so what I often think from a pain perspective is we've got the light blue areas there. We've got the pelvic organs that are unhappy, and these can be the triggers for a flare. If you've got a period, if you're constipated, got gastro, urine infection, overfull bladder, they can be the triggers. Then we've got the pelvic muscle reaction to those pelvic organ pains. That's often the worst pain. That's the pelvic muscle spasm. It's a cramp in the pelvis. And then we've got the feel bad symptoms, which are all the other things you can't see, you won't see it at operation. And of course, we've also in the green got the endometriosis lesions, and we've also got the effect of adverse life events and difficulties, sometimes from an early age, that are an overlay of further difficulty on top of the whole picture. So what you can see is quite a complicated picture, and it's complicated for you, but it's also complicated for your health practitioner. And nobody leaves their training with all the skills to manage this. And you can also see why removing the endometriosis is important, and surgery undoubtedly has a role. But to be really well, you've got to tackle the big picture. Next, please. So what are we doing for it at Pelvic Pain Foundation? Well, there's so many areas in endometriosis and pain that need to be improved, that there's years and years of work for everybody in all this whole area. There's so much that needs to be done. Our focus is on education. And so we've got our website, which has a lot of information for people that are wanting to learn more about pain. And we do our best to address the pain aspect and of endometriosis, and including other types of pelvic pain as well, because a lot of them are so related. And so this is our website, which is involved in giving out information to the public. And we also are giving information and training health practitioners to try and improve that general ability to help you as people affected by these problems. Next, thanks, Kyle. And of course, the other thing we have is our Pep Talk Schools program, because part of the National Action Plan was that women in Australia wanted a better deal for the next generation. They wanted the next generation to have a better life than they do. And so our periods pain and endometriosis schools program is now happily in every state. Some of the states have been slower to come on than others, but they've all signed up now. So you will see a rapidly increasing number of students coming through who've had the benefit of learning from an earlier age to try and cut down that time until they actually experience problems, and time to diagnosis and time to help. So we've already visited more than 40,000 students and teachers. They're the ones that have filled in our feedback and things, so we're getting great data there. We've done well over 1,060 school sessions and growing. And some of these are big groups and some of them are little groups. So we go to regional centres that often miss out so badly on any assistance, and we help whoever feels like they need that in their school. And we've enlarged Pep Talk to include things like helping athletes be able to keep going with their sport, because so many students drop out during those years. And we now even go into juvenile detention centres in very small groups to help those people that are so unserved by so many services. So, and the data we're obtaining from these groups show that the problem is even bigger than we imagined, and they're missing school and missing lost opportunities. So you can find out more about Pep Talk, including for the schools in your state and your area, by going to the website. So I think that must be my time up, Liz. But once again, it's such a pleasure to be with you today on such an important topic where there's so much work to do. Thank you.
Thank you so much, Associate Professor. That was really fantastic and great to have a deeper understanding from a medical and anatomical point of view, as well as how the Pelvic Pain Foundation are helping. And I really wish that Pep Talk program was around when I was at school. That's really fantastic. We'll now hear from Alexis Wolf. So Alexis Wolf is the CEO of Endometriosis Australia. Alexis's passion and notable leadership qualities led to her appointment as the CEO in May 2021. So previously holding senior roles in the not-for-profit and corporate sectors, Alexis has led successful and determined teams to raise over $50 million. As the leader of Endometriosis Australia, Alexis works to raise patients' voices and bridge the gap between patient experience and the health system. As an endo warrior herself, Alexis is driven to increase awareness, provide education, and invest in research for endometriosis. Thank you so much for joining us, Alexis.
Thank you very much, Liz, for that lovely introduction. And thank you all for joining us here today. It's such a wonderful opportunity, and to echo what Dr. Evans mentioned, it's such a wonderful, nice opportunity to speak with you all today. So I'd like to acknowledge the First Nations people and custodians of the land in which I meet today, which is the Gadigal people of the Eora Nation, which is also known as Sydney. I pay my respect to their elders past, present and emerging, for they are the future leaders of this country. Next slide. Thank you, Kyle. Thank you. So endometriosis is one of the leading organisations for endometriosis in this country, and we've been working tirelessly for the past 10 years to bring endometriosis into the public forum. Our goal is a world where everyone with endometriosis can thrive. It seems like a simple ask, but it's got a long way to go. And I guess in terms of what that looks like is we're working towards an improved quality of life for endometriosis patients, speed to diagnosis, as Eva mentioned, accessibility of expert services, quality of treatment, public understanding, which we're doing here today, being part of a community, and one day hope for a cure. There is still no cure for endometriosis, so we need to live and manage these symptoms as best we can. Our purpose as an organisation is to increase awareness, provide education, and really to invest in research for endometriosis, which does affect 1 in 9 Australian women, girls, and those who are gender diverse. Next slide, thank you. So in my role here as CEO, I hear, read, and respond to countless inquiries from patients across the country who are trying to navigate their workplace and managing their endometriosis symptoms. As highlighted by Dr. Evans, endometriosis is a complex disease. And there's also a sliding scale in terms of the presentation of symptoms. So whilst many can actually manage their symptoms quite well, we do have the opposite end of the scale who are really challenged by their ability to function on a monthly or daily basis. Here we have a few comments that I've received just in the last month. So you can see the challenges that we have around how individuals are trying to communicate. So I would love to bring up more awareness, to help bring more awareness, especially to the workforce, as I struggle to get my colleagues to understand how debilitating having endo is. Next slide. I recently had surgery, and since returning back to work, my manager has been micromanaging me. I love my job and I'm good at it, but I feel suddenly she makes me feel like I'm incompetent and fragile. Next slide. I should stay at home when the pain is this bad, but I worry about losing my job. Next slide. My manager doesn't understand. He said everyone gets period pain and I just have a low pain threshold. As you can see, these patients, they want to work, they're committed to their roles, and in many instances, they're just struggling to reach an effective way to communicate and understand endometriosis with their managers and with their colleagues. So whilst we had anecdotally known that flexibility for patients is a really important part of managing their symptoms, we actually took the opportunity of COVID to do a survey and to start this research and get more information that we could use to develop programs. So 389 endo warriors, that's what we call endometriosis patients, responded to this survey, and I'd love to share those results with you. Next slide. So 70% of patients are taking unpaid time off work to manage their symptoms. So with a chronic disease such as endometriosis, the provision of 10 sick days a year can be quite easily exhausted. 50% of patients said a lack of flexibility was a significant barrier to managing their endometriosis symptoms. And most startlingly, the results putting numbers around the impact of endometriosis had on employment and career opportunities. Patients reported that 1 in 3 have been passed over for a promotion and 1 in 6 had lost their job due to endometriosis. Now, if we take a step back and we think about the possible behaviours of a patient with endometriosis and the symptom presentation, what might that look like? They may be perceived as being lazy. They may be considered not committed. They may be considered vague or even unreliable. And what we know about endometriosis patients is that a lot of the times their symptoms can be really challenging and unpredictable. So as much as they have a toolbox of things that they know can work, it's not always as effective as it hoped to be. Next slide. So when we dug a little deeper on how COVID actually impacted endometriosis in the workplace, we discovered that 79% of patients reported that workplace changes had made a significant impact on their endometriosis management. Wow, isn't that great news? 60% of endo warriors said that they were more productive working from home. Now, this is in line with general population studies, so we know that to be true. And 90% stated that flexibility in relation to time management and working from home was the most important factor to improve their endometriosis management. Now, when we talk about, I guess, time management and working from home, that's not always possible for every industry, for every role. And it can be quite challenging to have those discussions with an employer and employee relationship, and something that we're looking to work towards moving forward. We know that a retail worker, a miner, an electrician can't really work from home. However, potentially their hours could be adjusted. And so things like starting late or finishing early because they need to take medications that might have a short-term impact on their cognitive ability could be really beneficial. It might be that they need to have some flexibility to attend medical appointments. There's lots of individuals that will be reaching out with their endometriosis to an array of medical professionals to help them with their treatment. And that's not always possible just with one person. As Susan mentioned, this is a complex disease. It requires complex treatment and management from multidisciplinary individuals. So attending appointments is something that many endo warriors will actually find challenging and hard to bring up with their employer for being perceived as constantly taking time off work. But as many of them reported to us, they just simply want the ability to be able to make up their hours in their own time and have that trust and confidence that they're going to get the job done. Next slide. So having said that, there's many alternative structures that can be implemented in any workplace environment, which patients reported to have additional benefit. So these include access to 20-minute rest breaks when needed. So not every day, just when they need it, just when their symptoms tend to be flaring up. Also access to healthcare benefits or services such as counselling if your organisation has EAP, making sure that employees know about that and have the opportunity to call those services and to utilise them. That's what they're there for. Or if your organisation has things like mindfulness or exercise activities that they're done as a group and that they can bring people together. We know that with endometriosis, there's a common saying, motion is lotion. And so being active actually can help with your endometriosis symptom management. Sitting down for long periods of time, whilst can be relieving, can also be challenging for endometriosis patients. Following this, physical aids such as ergonomic chairs, heat packs, and props can be extremely effective and demonstrate ongoing commitment from an organisation to invest in the well-being of patients. So as you can see, endometriosis patients are not asking for unreasonable requests. They're not asking for huge amounts of additional leave provisions. They're just asking for an open conversation and the ability to work with their employer to try and find a solution. Next slide. Endometriosis Australia is presently developing an Endo at Work program, which is to be funded by the federal government and Department of Health, which will be an evidence-based co-designed program for patients and employers, which will be creating pathways for both employers and employees to navigate endometriosis in the workplace and providing tools and guidelines to show how workplaces can adopt and integrate small changes into their existing frameworks to support patients. To that end, we've continued our research, and I actually have a few additional pieces that I can share with you today. This research isn't published yet, but I thought it'd be a good opportunity to share some of these with you. So over the 2/3 of respondents have mentioned flexibility around the timing of their breaks was important at work. So having the break is one thing, having flexibility of the time, very important. Half of respondents have the option to work from home to manage their symptoms, but as we mentioned, not always possible for every type of industry. Over half of respondents' workplaces did not offer any modifications to roles so that they could manage their endometriosis symptoms. And this is the needle we really need to move. We need to have a conversation and open that up to really see what is possible, what is going to be an option for everybody. And lastly, more than 60% of employed respondents felt that endometriosis had impacted their career trajectory more broadly, and so having to reduce their work hours or go into the casual workforce. So next, I'd like to introduce you to an amazing endometriosis patient, Laura. I'm going to tell you a little bit about Laura. She's pretty bloody amazing. She was 19 and in her first year of university when one day the pain that she'd been ignoring for almost a decade had just gone into an overwhelming state, and she collapsed in the middle of the playground. She dutifully took herself to emergency, where doctors looked at her symptoms and said, "You must have appendicitis." Of course, that's what it is. The doctors reeled her into surgery. She thought, great, this is fantastic. I'm going to have this solved. Wheeled into surgery, opened her up, and very luckily for Laura, the doctor that was treating her recognized that she had endometriosis straight away. He said, we don't need to remove her appendix. This is not the problem. He closed her back up and she went into surgery a few weeks later to actually get a diagnosis around endometriosis and to have those lesions removed. Laura felt great. She had a diagnosis. She had a small treatment plan. She thought she was just going to be going on with life and things were going to be great. She continued her studies as an early childhood educator in primary school, and she was doing incredibly well. But shortly after, she collapsed again. The pain had got so bad that it was now moving into her lungs. She felt like she couldn't breathe. She felt like she was having a heart attack. She took herself to emergency again. She said, I've got endometriosis. Could the pain be related? And the doctor said, no, I think you've just got bowel issues. I think you're constipated. Sent her home with some tablets and said, you'll be fine. A few days later, things did not improve. She went back to hospital. She then spent months in appointments, in scans, in blood tests, seeing constant specialists, to finally get a diagnosis that her endometriosis had actually traveled to her diaphragm, and that was where her pain was resonating. Now, I tell you this story because Laura had a dream of being a primary school teacher. That's all she wanted to do when she was young. She went to university, she studied, she got her degree. She was incredibly proud of herself. She'd started teaching, but her symptoms were so debilitating, and the lack of flexibility that the teachers, I guess, had for her meant that she had to stop doing her dream. The three things that she asked for were not unreasonable. She asked if she could have an ergonomic chair to sit behind her desk in her classroom. She asked for a microwave to be put into her classroom so she could heat up a heat pack so that when she was feeling pain, she could have some heat relief. And the third thing she asked for was a volunteer parent to come into the classroom just twice a week so that she knew that she had an option if she wasn't feeling well to take a small break. These things were unable to be met by the teaching association, and so she left the profession. Now, Laura is a fantastic individual, very motivated, and she actually went on to create her own business. She ran a very successful swimwear business that was, recognized here and internationally, and she's doing incredibly well. But what we've seen here is a story that I consistently hear from patients, is that they're leaving the workforce to start their own businesses because businesses were not able to come up with a solution that was able to be flexible for both parties. Now, I hope that narrative is changing. Laura, when this was happening, that was about 15 years ago. I'm certain that now, if an endometriosis patient had a conversation with their employer, that there should be a really good understanding in terms of, let's see what we can do here. Let's open the conversation. Let's see how we can make sure that you are going to remain a valued employee at this organization. So really, the question we really need to ask ourselves is, what's the cost? What's the cost of losing an employee, a fabulous employee like Laura, to your organization? The cost that she was asking for was about $400 to invest in a chair and a microwave, a one-off cost. Is $400 worth having to recruit a new person, having to have a role unfilled for many, many months, Is this small change something that employers can make to be able to support endometriosis patients? I think the answer is yes. I think everybody here is here because they want to learn more, because they want to find solutions, because endometriosis patients have a sliding scale. Some of them very, very able to manage their symptoms. You probably wouldn't even know they have endo. Others, it's the other end of the scale and they need a little bit more support. And I think we as a society, we can wrap our arms around them and we can make sure that they have that support. Next slide. So at Endometriosis Australia, we're embracing endo and we want your organisations too. So simple ways that you can do that within your organisation is you can potentially hold a high tea within your organisation, have a conversation, talk about some of the things that have been discussed today. Educate your colleagues and your managers to make sure that they know that there could be people within their teams that actually have endometriosis. You can celebrate endometriosis during March Awareness Month in 2023. It is a whole month dedicated to endometriosis, so there's no excuses in terms of the day doesn't align to an activity within your organisation. You've got a whole month of days to choose from. You can encourage workplace giving within your organisation to Endometriosis Australia. And I also encourage you to visit our website, endometriosisaustralia.org, to just learn more. Happy to answer any questions, and I really appreciate everybody's time here today. Thank you.
Thank you so much, Alexis, for everything that you shared just then, including Laura's story. That hearing about the impact on women's careers is really astonishing. So obviously all the more reason to share awareness and education, and great to learn about workplace interventions to help. And I think Hayley is also going to share more on this in a moment. So I'll introduce Hayley. She's just let me know she's having maybe some mic issues, but I'll do my spiel and we'll see how we go. So Hayley Davies is the team leader of South Australia for Recovery Partners and is an experienced senior rehab counsellor with a Bachelor of Behavioural Science Psychology qualification. Hayley has extensive experience in providing vocational rehab services to assist individuals with complex and multiple injuries, including chronic pain, mental health conditions, and disabilities return to pre-injury, new employment, and normal life. Hayley is also passionate about promoting the many positive benefits of work in people's lives and developing new health and wellbeing initiatives to reduce the human and financial cost of injury and illness in the workplace. So hopefully, Hayley, I can pass over to you if your mic is working.
Thank you for the intro, Liz. Can you hear me? We're back. So I'm going to speak today about endo from a work health safety, rehabilitation and return to work lens. From a work health safety perspective, although endo is a non-work related condition, it's important for organisations to be aware that they have a duty of care to their employees who have existing illnesses or injuries such as endometriosis. They have a requirement to do what is reasonably practicable to provide a safe working environment to minimise harm and prevent further injury. Work health safety laws state that employers also have a responsibility to manage work health safety risks, provide early intervention to support recovery, and make reasonable adjustments to ensure all employees can perform their job effectively. So what can organisations do to manage the work health safety and psychosocial risks of endo in the workplace? Start with identifying some of the risks associated with those suffering from endo, such as pain, fatigue, nausea, stress, medication side effects, drowsiness, that can impact on alertness, attention, memory, concentration, physical function, ability to drive, operate machinery and work safely, which we know may lead to accidents or injuries. We know that there are also key work-related factors that can also contribute to these risks, such as high job demands, high workloads, high emotional or physical demand roles, low job control, having no flexibility about how you manage your work tasks and schedules or hours. The physical work environment may be unsuitable for management of symptoms. For example, remote working employees or construction site workers, where there may be limited access to toilet facilities, the opportunity to take regular rest breaks and attention to issues such as temperature control, proper ventilation, access to cold water and social support at work. Factors such as low job security, employees having a fear of losing their job, low job satisfaction, missing out on those promotions or project opportunities. Employers can be unknowledgeable on the topic of endo, or there may be poor organisational support. So the next step is to undertake a risk assessment in your organisation and assess the risk of what interventions can be applied to reduce the potential for harm. For office-based employees, this risk may be fairly low, but for heavier physically demanding occupations, the risk may be higher during endo flare-ups. So when managing work health safety risks in the workplace, it can be useful to adopt the hierarchy of control model when considering interventions. And the hierarchy of control model is a 6-step approach to eliminating or reducing risks, and it ranks risk controls from the highest level protection and reliability to the elimination of hazard through personal protective equipment, which are the lowest levels of control. So the first step, elimination. Can you physically remove the hazard? For example, remove the need for long distance travel for work, eliminating excessive work demands by setting achievable workloads and performance targets. In some cases, elimination of the operation of heavy machinery may be required. Substitution. Can you replace the hazard? So can you hold meetings via Zoom, telehealth? Can you substitute the change or shift with another employee who is required to travel or be on site during that time of a flare-up? Can you plan fly-in fly-out arrangements for mine workers during monthly cycle times where symptoms aren't as present or less severe? Isolate. Can you isolate people from the hazard? Probably unlikely, but you might be able to offer a quiet room or work area for employees to take a nice rest break, practice some exercises or stretches, have their heat bag for a few moments. Engineering controls. Can you engineer the hazard? So workplace notifications, ergonomic assessments, sit-stand desks, ergonomic aids, temperature adjustments, supply manual handling equipment. Administration controls. So can you change the way in which people work? Working from home, making sure they have a suitable ergonomic setup, flexible work hours, schedule less face-to-face meetings during known flare-up times, plan to undertake tasks that are less time pressured and can be done from home, such as report writing, reducing stress and exposure to triggers wherever possible, provide safety training, supportive workplaces, support plans, and remove barriers to employees accessing their supports. And lastly, PPE, personal protective equipment. You might be able to provide some wheat bags, belly compression bags, manual lifting aids, EAP and counselling services. Next slide, please, Kyle. So endo is a hidden disease and is largely undisclosed in the workplace. We know that approximately 1 in 9 individuals assigned female at birth has endo. It could be a safe assumption to say that there may be someone in your workplace who may experience this. Employees are not required to disclose information about a medical condition to their manager or supervisor if the condition does not affect how they do their job, but it is encouraged. So under work health safety laws, employees have a duty to take reasonable care of their health and safety and not adversely affect the health and safety of others. So you should consider whether your symptoms or medications you are using to treat the symptoms are affecting your ability to work safely or could impact on the safety of others. So for example, consider your pain and other symptoms. Are they causing you to become distressed or distracted? Is your pain stopping you from preventing your work in a safe way? Is your fatigue affecting you in a way that could be harmful to yourself or others? Although it's a sensitive topic, explaining endometriosis, your symptoms and how they affect your work life will help your manager better sympathise with your situation and be able to put helpful supports in place to assist you. Next slide, please, Carl. So what else can organisations do to support individuals with endo at work and encourage those with endo to communicate their concerns? Build a supportive workplace culture. So train managers to be supportive and react appropriately. Find ways to keep them engaged and productive and comfortable at work. Start a conversation, and I'll come back to this in a minute. Medical certificates. So in many cases, the symptoms of endo will be ongoing. When someone who is suffering from a chronic disease such as endo, they may require varying periods of leave from work. A recommendation is to accept an overarching medical certificate recognising their condition from their treating doctor and put in place a support plan with assistance from the treating doctor to be able to manage their symptoms at work. Flexible working arrangements. As Alexis has mentioned, this is the most valued workplace adjustment by endo warriors. We've talked a bit about job modifications, so regular rest breaks, pacing tasks to avoid burnout, reducing workloads, planning ahead for project timeframes, deadlines around flare-up cycle times. Modifications of work tasks should be discussed in consultation with the employee. Workplace adjustments can be implemented, sit-down desks, ergo chairs, anti-fatigue matting, heat packs, lots of different props as well in the workplace. Encourage frequent changes of posture as Susan and Alexa supports movement, supports their symptom management. Reducing exposure to high stress situations, providing greater support like putting instructions in writing, modifying the work area, noise control, light, temperature adjustments, changing the work location if needed, access to restroom facilities, and consider this with employees who may work in the construction industry, traffic control, mining. Providing portable, clean and safe toilets may be part of the solution. Policies and procedures, so developing, implementing and promoting policies and procedures in relation to chronic diseases such as endo can assist in raising awareness and understanding of the disease and should be considered in sickness absence management, considering work health safety laws and compliant with relevant legislation such as Equal Opportunity Acts, Anti-Discrimination Acts in your jurisdiction. Some secondary workplace interventions: appoint an endo champion in the workplace, a go-to person for information, a support person to assist with applications through HR for workplace adjustments, discussions with the line manager, and provide a pathway for female staff to access confidential work support due to the gender-sensitive nature of these issues. Health and wellbeing programs can be effective, including access to allied health interventions, employee assistance programs, mindfulness coaching, breathing techniques, pain education, healthy lifestyle education, and exercise programs. Our endo first aid kit, which is a PPE control, which we'll get to in a minute as well. Stretches and postures, so specifically during posture breaks, movement is important. And regular exercise can have a positive effect against diseases that involve inflammatory processes such as endo. It helps to reduce estrogen levels, improves emotional well-being, energy levels, motivation, self-confidence, quality of sleep, and work productivity. Endo Awareness Morning Teas. So March is Endo Awareness Month, and earlier this year, Recovery Partners held a Wear Yellow for Endo Tea Day. So the colour yellow is a symbolism of endo in Australia. Develop a toolkit of resources to display around the office, lunchroom, restrooms, and distribute to staff. Next slide, please, Carl. So here at Recovery Partners, we have put together an endo wellness and first aid kit with useful items for managing flare-ups in the workplace. With some additional optional items that you might like to include as well. So specifically, Recovery Partners have put together exercises for endometriosis poster, which is included in there. The Endometriosis and Pelvic Pain book by Susan Evans. The endo first aid kit that we've put together is also available for purchase on our online safety shop, which we have at a discounted price for the next 2 weeks for our webinar participants. Next slide, please, Carl. So start a conversation. Ultimately, everything we've discussed are recommendations for supporting individuals with endo. However, all endo experiences are different, will have varying symptoms, be undertaking different treatments. They'll be at different stages of their journey, either waiting for a diagnosis, preparing for surgery, recovery, on their fertility journey, or may have secondary physical or mental health concerns, and will require an individualised support plan in the workplace. So what supports work for one individual may not be required for others or not suitable. Everyone's different. The best thing to do is ask them what they can do, what you can do to support them in the workplace. What aspects of their role are they having difficulty with? So ask if you're noticing a pattern of time off work each month, start a conversation. I've noticed that you've been needing to take some time off work. Is there anything I might need to be aware of? How can I support you? And be supportive, provide a safe environment to have those sensitive discussions. Listen and refrain from judgment and take a biopsychosocial approach. So consider the individual, their symptoms, their belief about their conditions and pain, challenges with completing their work duties, the work environment, job satisfaction, their attitude at work, their leave balances, family situations, social support, financial concerns, other medical health conditions, and overall health and well-being. And at the very least, be understanding or think of how you can support your employees to overcome some of these barriers. By addressing the biopsychosocial barriers, this can improve outcomes with improving presenteeism, absenteeism, pain, disability, and well-being. Rehabilitation counsellors and return to work specialists can assist in this space. One client was referred to Recovery Partners by the employer had been off work for 8 months, and the organisation was unaware of the reason for their absence. So by myself reaching into this employee, conducting a biopsychosocial initial needs assessment, she disclosed that she was suffering from endo, had taken time off for surgery during that period, become depressed, a condition from not being at work and not participating in her normal life. She wanted to return to work, but was experiencing debilitating pain, fatigue, side effects from medication. Mornings were extremely difficult to get out of bed. She was having difficulty completing home tasks, driving, and needed time to attend medical appointments. So with consent, we had a confidential conversation with her direct supervisor. Not everyone in the workplace needs to know. We identified potential suitable duties for her to return to, case conference with the GP to confirm capacity, to return to work and medical recommendations, starting with reduced work hours and working from home and provision of a home ergonomic workstation setup, and some temporary supports around the home to enable her to start the return to work process. Referrals to allied health interventions, psychologist, pelvic physiotherapist, exercise physiologist help to improve capacity and confidence with returning to work and life. So keep in mind that if an employee does open up to you, it doesn't necessarily mean that they want to continue to go over their story again and again each month when they may be experiencing a flare-up. For many endo warriors, this can be traumatic. A close friend of mine who has suffered from endo for many years told me that during bad flare-ups, she used to have a code word with her employer that she could send a text message, email, I'm not sure what that was, but for example, you could plan that with your employer. It might be the code yellow. Next slide, please. So here at Recovery Partners, our mission is to reduce the human and financial impact of injury and illness, including endometriosis and mental health conditions in the workplace. Recovery Partners recognises the health benefits of good work and the importance of keeping endo warriors engaged in the workplace. Our award-winning initiative, Yellow Partners, More Than Women's Issues in the Workplace through SafeWork SA, will enable us to deliver a series of informative sessions to South Australian-based and national employers to educate and support organisations on endo awareness and further understand how to build a supportive workplace culture, support their staff. If your organisation is interested in an endo awareness workshop or lunch and learn session, we would love to get in touch with you. Recovery Partners also provide specialised assessments, return to work services to support with chronic disease, injury management, return to work, and along with other many mental health and wellbeing programs. Next slide, please, Carl. So lastly, as a big thank you to our audience for joining today, we have several endometriosis and pelvic pain books by the lovely Susan Evans to give away. The luckily registrants will be selected at random and will be notified by email in the coming days, so please check your inbox. We also have some useful resources to send out to you, including our Endo for Employers checklist, with some useful tips for creating awareness and supporting endo in the workplace. We have our very own Eva's exercise for endometriosis poster ready to send to you as well. And as mentioned, the Endo First Aid Kit is available for purchase on our online safety shop. The sale price is $169 ex GST for the next couple of weeks. I would also encourage you to head to the Pelvic Pain Foundation of Australia and Endometriosis Australia websites for further helpful resources. And of course, if you'd like to make a donation to the great work that they are doing, Endo Warriors throughout Australia will be grateful for that. Over the next few slides, we've listed some additional support groups and reference lists that you might be interested in for further research on endo. Thank you so much for your listening, and I'll hand you back over to Liz.
Awesome. Thank you so much, Hayley. Some really great suggestions in there for interventions. And it seems like a lot of positive change can start just from having a conversation or asking a question, which is a great segue into our question and answer segment. So I am aware of the time and understand some people may need to drop off, but our lovely speakers have agreed to stay around for another 10 to 15 minutes. So if you do have a question, now is the time to please pop that in the chat box. As mentioned at the beginning, and as a disclaimer, this is a broad presentation about endometriosis in the workplace, so we cannot provide any individual medical advice. So any individualized treatment questions really need to be directed to your health professional. So please, we really encourage you to put your questions in the chat box. Looks like there's one in here. So this person has signed in as a guest, so I'm not sure who it's coming from, but they have asked. They said, thanks so much for your informative presentations. My question, what are the risks of leaving endometriosis undiagnosed? Is there such a thing as leaving it too late and ending up with irreversible damage? So I might pass that one over to Associate Professor Evans.
Okay, so I think it depends on the person. It depends whether you mean pain or you mean the lesions in the pelvis. So the severity of the lesions in the pelvis varies enormously from people that have one tiny little area of endometriosis to people that have very severe disease. And I think that it is true that if someone's got severe disease, that it is good to get that sorted out, diagnosed and managed appropriately. But it's like the pain and the lesions go on different pathways. Then there's no good correlation between the severity of the lesions and the severity of the pain. So it depends what you're talking about, I'm afraid. I think you can often, these days it gets easier. You can have an ultrasound that will show you if there's very severe disease, as in large amounts of disease in the ovary, if you have a high quality ultrasound. And from the perspective of the pain, if your pain is being well managed, then that's a good thing. So I'm sorry to be not very specific, but it really does depend on the individual.
Thank you, Susan. Hopefully that helps answer that question. Someone has asked if the recording will be available. Yes, it will be available. Another question from Cheyenne. Can a medical certificate be obtained for your workplace if you have not had the surgery yet? So I'll open that up. Alexis?
Yeah, absolutely. You can. Your GP or your treating medical professional may be able to provide a medical certificate to say that there is suspected endometriosis, particularly as Dr. Susan Evans mentioned, if you have had an ultrasound and it is present in an ultrasound, then it's very clear that that is what it is. Technically, the way that endometriosis is diagnosed in Australia is via a biopsy, which comes from a laparoscopy. So yes, the comment there around surgery, there are very long wait times for surgeries across the country. So that is another added pressure for patients to potentially get a clinical diagnosis and also some potential symptom relief. So it is very important that employers and employees work together with the health professionals to ensure that if there are extended wait times, think, upwards of 12 to 18 months for some individuals to get that official diagnosis, that it is able to come through in a medical certificate.
Thank you, Alexis. Tamara has asked, I've heard that once you are diagnosed with endometriosis, you are more likely to suffer from other conditions, for example, thyroid. What is the likelihood of this occurring, and does it happen later in life or concurrently? So that might be one for Susan.
Yes, I think that there's no doubt that endometriosis that changes in the immune system are involved in endometriosis. The immune system and activation of that is part of the inflammatory picture that underlies both the lesions and the pain. Now, some thyroid conditions are part of the autoimmune conditions as well. So there's a lot of links across the immune system. And women have been saying for a long time that I think there's something wrong with my immune system. Now, that covers a lot of things, but my view is that they're right.
Thank you, Susan. And someone mentioned that they're booked in for surgery in about a week's time. So do you want to...
Yes, I think that what I would say about that is great, but you don't have to see the surgery as your first step in managing your pain and well-being. The surgery is like one thing along the way. It's one part of your treatment. There are many things that you can be doing straight away to improve your well-being and mean that you recover better from a laparoscopy. Now, on the Pelvic Pain Foundation website, we have a page called Tips and Tricks for Recovering Well from Laparoscopy. And that gives a lot of advice for people in the few months beforehand, the lead up, how to recover well, what questions to ask, those sorts of things. You don't have to wait for the laparoscopy as the first step to feeling well.
Awesome. Thank you, Susan. Good to know.
But also just good luck. Hopefully you do have a successful surgery, and that, you're able to get the support that you need during that time. So yeah, endo wishes to you.
Thank you, Alexis. I think Jemima has asked, is it possible for the symptoms of endo to change over time?
Yes.
You want to do that, Alexis? Yes.
Yes, absolutely. Symptoms, and for as many endo warriors would report, something that worked for you in terms of your treatment plan in your 20s might not be something that works for you in your 30s or 40s. There are many endometriosis patients who, they have a toolbox of things that work in their 20s. They say that their symptom load comes down extremely low, and then potentially in their 40s, things start to go haywire again. So it is not a linear disease. It is not something that can be a one-stop shop in terms of your approach to treatment. It does need to be investigated multiple times throughout your life. So yes, it is complex, but there are many support networks. And I think the really important part that Dr. Evans would also reiterate is finding a strong team of medical professionals who you trust and who you can consistently go back to in terms of changing symptom presentation.
Did you want to add anything, Susan? Or someone's just asked a very similar question. Can endo spike and dull over time?
Yes, I think if you look at the picture that I had of all the different organs that are involved, then they don't all necessarily happen at once. Often as a teen, there might be period pain, and over time things change. You might find that later on you get some of the other symptoms, or that when there's been a treatment that's been going well, and then when it changes or your life changes, or the symptoms change a lot. That's right, beautiful. They tend to become more complicated over time. In other words, a few different pains. Some people come in and they say, oh, I've got my endo pain. Well, I never accept that description. I know what they mean, but usually I say, so you've got one type of pain or a selection of pains? Oh, no, I've got a selection of pains. And from this diagram, you can see they do have a selection of pains. So considering that it's all the lesions and it's all just one type of pain is one of the big mistakes that's usually made. You have to address all the issues, whatever's bothering you at the time, and be prepared to tweak it a bit over time.
Thank you. I can't see any more questions for the time being, so we might wrap up. So thank you so much to our speakers today, and equally to our audience for tuning in and asking some brilliant questions. If you would like support with endometriosis in the workplace, obviously there's Pelvic Pain Foundation and Endo Australia websites, and you can also contact Hayley Davies about the workshops that she mentioned. And please keep an eye on your inbox to see if you are one of the lucky recipients of one of Susan's wonderful books. And if you're interested in the first aid kit, that's on our web shop as well. So we'll send all these slides and recording and links shortly. We really hope that you found today helpful. And you can follow us. We invite you to follow us on LinkedIn and Instagram and Facebook so you can learn about any upcoming events. And we do endeavour to have another Endo event next year. Thank you again to everyone, to our speakers, to our audience. Really appreciative. We've had some great feedback already. So thank you, everyone. Enjoy the rest of your day.